Welcome to today's update. Let me start, as usual, with the latest statistics. I can report that the total number of positive cases reported yesterday was 677. That is 6.7% of the total number of tests carried out. And it means that the total number of confirmed cases is now 100,783. That figure for confirmed cases passed the 100,000 mark yesterday, which is a reminder of the scale of this pandemic, especially when we consider that the actual number of people who will have contracted COVID over the past 9 months or so will be higher than the number of people with positive test results. 178 of today's new cases are in Greater Glasgow and Clyde, 114 are in Lothian and 103 in Lanarkshire. The remaining cases are spread across the other 8 mainland health board areas. I can also report that 974 people are currently in hospital, which is an increase of 23 from yesterday, and 59 people are in intensive care. That is 3 fewer than yesterday. And finally, 1 additional death has been registered in the past 24 hours of a patient who first tested positive over the past 28 days. I would, however, remind you that registration offices tend to be closed at weekends, and so the figures we report for people dying on Sundays and Mondays can be artificially low as a result of that. In total, since Friday's media update, 28 deaths have been registered, and that means the total number of deaths under this daily measurement is now 3,917. And of course, that figure reminds us again that this virus is still causing grief and heartbreak every single day to families across the country. And I want to send my condolences to all those who have lost a loved one to it. I'm joined today by the Health Secretary and the Chief Medical Officer. The Health Secretary will talk in a moment about the testing of designated visitors to care homes. The use of lateral flow test devices is being trialled from today in 14 care homes around the country, and testing kits will then be sent out to all care homes next week. Before then, I have 2 points that I want to briefly update on. The first is to confirm that over the weekend, Scotland received our first supplies of the vaccine against COVID, which has been developed by Pfizer and BioNTech, and which, of course, was authorised for use last week. And supplies of the vaccine have now been delivered to centres in different locations across the country. This morning, I visited the Western General Hospital here in Edinburgh to meet the staff there coordinating the delivery of the vaccine. And indeed, these will be people who get the vaccine tomorrow, and it will then be administered from tomorrow onwards. As you know, we set this out last week. Vaccinators, those carrying out vaccinations, will be vaccinated first. After that, we will focus initially on vaccinating residents in care homes for older adults, their carers and other frontline health workers. And of course, we then prioritise people over the age of 80 as supplies allow. This is obviously extremely positive news. As we've said before, the use of vaccination in time should enable all of us to return to conditions which are much, much more like normal life. But vaccination is, of course, a major logistical exercise, and it will take time to work our way through the vaccination programme, starting, as I've set out, with those most at risk of becoming seriously ill and losing their lives. The recent news, therefore, while hugely positive and welcome, doesn't remove the need for caution during this winter period. Instead, the fact that we are so close to being able to vaccinate the population as a whole should, I hope, encourage all of us to be that little bit more careful and to pay even more attention to the rules and guidelines to try to keep ourselves and those we love as safe as possible over the course of the winter period. And that's linked to the second point I want to touch on briefly. Tomorrow, as we always now do on a Tuesday, we'll announce the outcome of the latest weekly review of the levels of protection that apply in each local authority area in the country. Now, I'm not going to preempt that review, but I will just briefly mention some of the issues that we weigh up when considering what levels should apply to different areas. The first is that current levels have undoubtedly helped to reduce prevalence of the virus across Scotland, and that is a positive. If we look at the national picture, although this still fluctuates on a daily basis, the percentage of tests coming back positive at the moment has come down again to much closer to the 5% that the World Health Organization says is important for assessing whether or not the virus is under control. The picture varies from region to region, but the national situation is clear and positive. The number of new cases has been falling now for the last few weeks. That includes reductions in the 11 local authority areas which are currently in level 4. And we've always said when we applied level 4 to these areas that those authorities would move out of that level on Friday, and I can confirm that that remains the case. That will be the case. Over the course of today, we will be considering, though, what level should apply to these areas from Friday, and the Cabinet will take the decision on that tomorrow morning. We're also considering what changes, if any, should be made to the levels applying in other areas. As ever, our decisions will be based on the trajectory of the virus in each local authority area, as well as the need to protect capacity in the NHS, and we will also consider the social and economic harms that come from the restrictions. So we look at the hard indicators in each area, but also consider the wider context. And of course, right now, part of that wider context means taking account of the upcoming Christmas period and the challenges that it will inevitably pose. So in deciding on levels that will keep the virus suppressed through that period, we will continue to take a cautious and careful approach, and I will set out the conclusions of this week's deliberations in Parliament tomorrow afternoon. For the moment, though, can I ask all of you to stick to the current rules and guidance? It's really important that we don't drop our guard at this stage. Now that we can see the prospect of a return to a more normal way of life, we hope in the first half of next year, I think that should give us all the more incentive to stay safe and to keep each other safe over the period that lies ahead. If you're in any doubt about the rules in your own local authority area, you can use the postcode checker on the Scottish Government website. But just to recap, please don't visit each other's homes at the moment, except for essential purposes like childcare or looking after a vulnerable adult. If you do meet people from other households outdoors or in public indoor places, please stick to the 6 people from a maximum of 2 households limit. Please avoid car sharing if you can, work from home if possible, download the Protect Scotland app, and finally remember facts, the key basic rules that help to keep us all safe. Face coverings, avoid crowded places, clean your hands and hard surfaces, keep 2 metres distance from people from other households, and self-isolate and get tested if you have any of the symptoms of COVID. If we all continue, as we have been doing, to stick to these rules, then we can continue to see the levels of this virus go in the right direction as the vaccination programme kicks in the weeks and months to come, which hopefully all adds up to a brighter new year than the one we have lived through so far this year. Thank you very much for listening. I'm going to hand over to the Health Secretary to give an update on care home testing, and then we'll take questions from journalists as usual. Jeane.
Thanks very much, First Minister. I want to give 2 updates on care home visiting. Coronavirus testing, as the First Minister has said, for designated visitors of care home residents starts this week with a trial across 5 local authority areas involving 14 early adopter care homes which are in North Ayrshire, Fife, Argyll and Bute, Inverclyde and Aberdeenshire. That trial this week allows us to work with the homes and the staff there to address any immediate issues. We will then accelerate the delivery of testing kits to all care homes across Scotland from next Monday. Testing kits will be sent out to each home, along with guidance and training materials, which will be finalised following this week's early adopter trial. There are, of course, a number of steps that care homes need to put in place before they can commence visitor testing. That includes full staff training, and we've been working with NHS, National Education for Scotland, who are developing the guidance and the training for care home staff. For any care homes who might be unable to use lateral flow tests before Christmas, PCR testing of visitors will be made available so that we can have visiting over the festive period. It is important to remember that testing is in addition to and does not replace the other vital layers of protection that we have against COVID. And all of these, reducing contacts, keeping our distance, wearing face coverings and vaccines when they come, work most effectively when they work together. But it is a positive step for care homes, for residents and their families, and will provide another important layer of protection for them against the virus, alongside the essential PPE and infection prevention and control measures that are in place. There is a significant amount of work underway from care homes themselves, and we are doing all that we can to support them, working closely with Health and Social Care Partnerships, Scottish Care, CCPS and COSLA as the kits are rolled out so that we can undertake in real time the solution of any particular problems or issues that might arise. The second update relates to a review of the care home closure period following an outbreak. You'll recall, I'm sure, that we have until now advised that care homes should remain closed to new admissions and visitors for 28 days following the last positive case or symptoms. In consultation with Directors of Public Health Scotland and the Chief Medical Officer, we're now recommending that this is reduced to 14 days from the last date of COVID symptoms, subject to a health protection team making an assessment and confirmation of safety in any particular care home. This brings that advice in line with advice from Health Protection Scotland's Antimicrobial Resistance and Healthcare Associated Infection Scotland, who declare an outbreak is over after 14 days if no new symptoms or cases develop, as long as there is that health protection team risk assessment. Taken together, we hope that this provides further support to care home residents, to staff and to families to return to closer visiting, safe visiting, and allow some of the issues that have been raised in the past, inevitably as a result of what we had to do in the early stages of the pandemic, to be positively addressed now.
Thanks. We'll move straight to questions. Firstly, Louise Scott from STV.
Thank you, First Minister. Just like to ask a few questions about the tiers. If areas are moved up or down to Tier 3 tomorrow, coming to place on Friday, will there be any additional support for the hospitality trade, who say the current support is not enough when during this period they usually bring in about 25% of their annual income? And just have you got any specific concerns of areas who could actually move up a tier tomorrow?
I'm not going to speculate. We are going through that process over the course of today. You know, we publish statistics every day, so you can look yourself to see areas where we've seen a rise in cases as opposed to the overall national picture, which is a reduction in cases. But we'll look at the latest data over the course of the day, and I'll set out those decisions tomorrow. The one thing that we are being firm about is that the level 4 areas will all come out of level 4, but whether they go to level 3, which I think is, you know, perhaps likely, or whether any of them might go to a lower level, that is something we will look at over the course of the day. But there are other areas that we will be looking at to see whether they can come down a level, and of course we will have to look at whether there are any areas that the data suggests should be moved up a level. But these are fine judgments that we take very carefully. We'll continue to talk to the hospitality sector. We have grant arrangements in place for businesses that are either required to close or have their trading disrupted, and they are open and accessible to businesses, not just in the hospitality sector, but across any affected areas. We understand how difficult it is, so we will continue to liaise with all affected sectors of the economy to see what further support can be provided. I recognise that it is not possible for government to compensate every loss that every business is suffering during these really difficult times, but we will continue to do our best to make sure that we are providing maximum support, and that's something we take very seriously. Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, the leader of Dumfries and Galloway Council, excuse me, Elaine Murray, excuse me, has said that the local partners there believe that Dumfries and Galloway should be placed in level 1 this week. The leader of Scottish Borders Council, Shona Haslam, has said something similar. For example, the Director of Public Health in Scottish Borders has recommended that that area moves to level 1. You spoke in your introductory remarks about trajectory, about the capacity in the NHS and the potential harms to the economy. With all those figures and all those statistics and those criteria, surely it must be the case that Scottish Borders and Dumfries and Galloway should move to level 1 tomorrow.
I will confirm that one way or the other tomorrow. I mean, there's no point having a process that we go through carefully. The indicators are important. I've never said otherwise, but I've also said on many different occasions that the wider context, so what the position is in neighbouring authorities right now at the early part of December, contemplating the Christmas period ahead. So we have to take account of that wider context. But that's the decision-making process that we'll be going through today. Cabinet will conclude that tomorrow, and I will set it out, I think, around 2:20 tomorrow. Glenn Campbell from BBC Scotland.
Hello, First Minister. A couple of questions. First of all, how seriously are you considering calls to cancel next year's higher exams, and perhaps for you and your colleagues?
You've disappeared, Glenn. I can't hear you anymore.
The NHS for Brexit and the possibility of a no deal.
Sorry, Glenn, I think I got the gist of your two questions there, but you froze and went silent in the middle. So if I'm missing a part of it, I'll let you come back and point that out to me. Your first question was about hires. I answered a question yes, I did answer a question at First Minister's questions in the Chamber last week, where I said we were continuing to consider what was in the best interests of all learners. We had previously said that a final point for decision on hires would be mid-February, but I indicated that we were likely to take that decision earlier than that. The Deputy First Minister, I know, is offering a statement to Parliament this week, perhaps tomorrow, to give an update on where we are with that deliberation and decision, but also to cover the situation with the return of university students in the new year. So assuming Parliament agrees that, then he will set out more of our thinking in that statement. Now, the next question is, I missed the first part of it, but I think it was about a no-deal Brexit, or the prospect of a no-deal Brexit, and particularly the impact on the National Health Service. I think the first obvious thing to say, which I don't think will surprise anybody, is that I am increasingly concerned, as I suspect many people are right now, about the prospect of the transition period ending at the end of the year with no trade deal agreed between the UK and the European Union. Any trade deal that is likely to be agreed at this stage is going to be quite a bare bones minimalist agreement, so we are anticipating some disruption and inconvenience anyway, but that clearly will be much, much worse if there is no agreement at all. So I very much hope that we will see breakthroughs in these talks literally over the course of today in order to be more optimistic about the prospects. And I think the UK government has to get real and really understand the implications for the NHS and across the economy if there is no deal agreed. In terms of the NHS, which I haven't seen some of the BBC coverage this morning, I think is what you will have been asking about, then clearly we look very carefully and have been looking very carefully at arrangements for medicines and other clinical consumables. We've established a national stockpile of around 60 critical care and supportive care and end-of-life medicines. We've got a stockpile of supplies of COVID treatments. NHS National Services Scotland is working to ensure adequate supplies of stocks of medical devices and clinical consumables. 88% of products are already at the target of 6 weeks of supply or above that, and the remaining items are on order and expected within the next couple of weeks. So there's a lot of work going on to make sure that the NHS has the supplies it needs. But all of this becomes a lot less stressful for everybody in our NHS if we see a positive conclusion to these talks over the next 24 or 48 hours. I mean, they really are in the end game now. Just before I come in here, I I saw comments from Michelle Barney saying that agreement really has to be reached by Wednesday. So that's the 11th hour or 5 to midnight state that things are at. And I think it's in everybody's interest for a deal to be struck. Okay, I hope that covered the points, including the points I missed of your question, but I'll move on to Fraser Knight from Global.
Thank you, First Minister. Just to touch on the lateral flow tests, you've relied a lot on these for the return of students to get home for Christmas, but also now for visitors to come into care homes. Last week, we saw Sheffield and Greater Manchester councils saying to some care homes that they shouldn't be using the lateral flow test because there are concerns over the accuracy of them. And the British Medical Journal said over a half of coronavirus positive results were missed in the Liverpool pilot by the lateral flow tests. What's your concerns, or do you have any concerns about the accuracy of them? And do you think that they'll be suitable enough to keep the virus out of care homes?
I'm going to hand over to the Chief Medical Officer, and the Health Secretary may want to add a word or two here. As I think people will have heard me say in different contexts around testing right throughout this pandemic, testing is really, really important, but no test is absolutely perfect. And we can never see testing as the only or some kind of magic solution to the challenges that COVID presents to us. PCR, which is the test we have been using so far, is often described as the gold standard. Lateral flow tests are much more rapid, and the Chief Medical Officer can talk a bit about their sensitivity and how specific they are. But we take certain protections with these. So if somebody tests positive through a lateral flow test, they will have a PCR test to confirm that positive diagnosis. So they are not perfect, but taken in the round with all of the other measures that we have in place, they can help us in the fight against COVID. In care homes, for example, the use of these tests do not take away the requirement to wear PPE and to follow all of the other mitigations that are really important to keep people in care homes as safe as possible. So it's really important that we always see testing as part of that bigger box of tools that we have against this virus, albeit it is a very important part of that mix. But I'll hand over to Gregor to say a bit more about the technical aspects of lateral flow testing.
Fraser, thanks for your question. I think lateral flow devices offer us a real step forward in terms of how we can approach testing for the future. So that's the first thing to say, is a new technology coming in. I'm very supportive of their use across the system because they have an awful lot of advantages compared to the PCR test that we've grown used to. But we've got to be very careful that we use them in context, particularly when we're using them in the role of asymptomatic testing, as we're doing in this example. So it's very important to state that they're not a replacement for those other protections that the First Minister has already outlined here. They're part of a multi-layered approach to protection, which can be really useful in making sure we've identified as many of the risks as possible in people who want to visit their loved ones within care homes. We know from the experience that the sensitivity of these lateral flow devices when used in trained hands is approximately 76%. That's very high. But of course, what we want to make sure is that when they're used in asymptomatic testing is that we're getting the best use of them to identify those people who may be carrying this infection. They are particularly useful in those who are most infectious, who have a high viral load, if you like, and are particularly symptomatic. But when they're used in asymptomatic testing, we've just got to be careful that we use them in the right way. And that's why they're part of this multi-layered approach to protection that's surrounding these care homes now. So used alone, they are useful, but used together with other infection prevention and control mechanisms, making sure that we're continuing to use face coverings where that's appropriate, to make sure that we're still employing physical distancing, to make sure that we're taking all the precautions that we would want to kind of take forward. That's when lateral flow devices play part of that multi-layered protection.
Just add a couple of points to what both CMO and First Minister have said. And on the first point, it follows on from what Chief Medical Officer said when he spoke about in the right trained hands. That's why we're undertaking the training work before the testing begins, and we'll continue to do that iteratively right the way through so that the test is used properly. by staff in care homes with visitors as they come in. And the other important part of all the steps that are there to try and prevent the virus entering care homes, but also once in care homes being transmitted from one resident to another, is twofold. First of all, the weekly testing of staff that we have been doing for some weeks now, that has been effective in identifying staff who have the virus, and they then, of course, self-isolate and seek treatment if they need that. And the second is the other element of asymptomatic testing we're introducing, which is asymptomatic testing for visiting health and other professionals to care homes, so that we are trying to make sure, as far as we can, testing along with everything else, that we prevent the virus entering the care home, and then once in the care home, all those other elements are there and designed to ensure that it doesn't spread within a care home.
So maybe just an opportune moment really to remind people that if you get tested for COVID and the test is negative, whether that's PCR or lateral flow, it shouldn't lead you to think that you can just behave without any of the other precautions, because it may be that you are at an early period of the incubation of the virus, so you could still have the virus that the test hasn't picked up. But even if you're genuinely negative, that doesn't mean that the day after your test or the day after that, you don't pick up the virus from somebody that you are around. So, testing is important, but it should never lead to some false assurance that you're not at risk from the virus, or that you are not at risk of passing on the virus to somebody else. And I think it's really important that we understand testing in that context. Lindsay Hannah from Bauer.
Thanks, First Minister. Can you confirm that the current restrictions set out in each level will remain the same after Friday? Or is there a chance that, for example, the rules for areas in level 3 could change?
We've no plans to change the rules, but I'll set out my decision about Friday tomorrow in Parliament once we've reached those decisions. Neil Pooran from PA.
Thanks, First Minister. On the mass community testing that was introduced recently, I was just wondering if there are any early results or conclusions that can be drawn from that. Is it picking up new cases that wouldn't have been picked up otherwise? And I think that, as the CMO mentioned earlier, in terms of the accuracy rate of the lateral flow test, if that's the right term, if that's around 76%, is that the case in the community testing that you're doing, or in more sort of specialised areas?
So I'll say a couple of very quick things, and then I'll ask Jeane and Gregor to respond as well. So the short answer is yes, the mass community testing has been picking up positive cases. We will hopefully publish more detail of that in the period to come. Obviously, we want to make sure that that is presented in a reliable and robust way. But an important point to make is that, with the exception of the test centre in Johnson in Renfrewshire, all of these other pilots have been using PCR tests. So any positive cases coming out of those will be in our daily figures. We're just not yet breaking them down to how many of them have come from these pilots. So they are picking up asymptomatic cases, and we will publish more detail of that as soon as we're in a position to do that. Jeane.
The only thing to add from me to all of that is that these community asymptomatic testing pilots have not yet finished. One or two of them have. The others still have a few days to run. And as the First Minister said, when we have all the results, we'll publish them, but we'll also look ourselves at how much more we can do in that area and use it in a targeted way.
I think it's some interesting early data that's coming through from these test sites just now, as we're trying to understand just the impact that asymptomatic infection has within each of these communities. We know that for some communities the levels have remained at a stubbornly high level for some time. So this allows us to drill down even deeper to try to make sure that we're breaking any chains of transmission with those who may be unknown to them passing on infection because they're asymptomatic. We know that people who are asymptomatic are less likely to pass on infection because they're less symptomatic and able to kind of shed the virus in the same way, but that doesn't mean to say that they can't pass on the infection. So by identifying these people at an earlier stage, what we would hope to do is to be able to allow those numbers to come down. And from the pilots so far, what we're certainly seeing is that some of these areas are showing certainly significant levels of asymptomatic infection that we're uncovering.
Thank you. Simon Johnson from The Telegraph.
Good afternoon, First Minister. Just a couple of issues. A lot of people will be wrestling at the moment with basically trying to decide whether they want to spend time with family at Christmas, which obviously they will want to do, but not wanting them to put them in danger with a vaccine so close. Can you give them any sense about how long they'll have to wait after their relative has been vaccinated before that relative can start receiving visitors? And secondly, I just wanted to ask you about a press release that's been sent out from the Scottish Hospitality Group, which says that hospitality businesses will receive on average £64 of government support per day over the peak festive period. And according to the press release, it says that this compares with £269 in Wales, £147 in Northern Ireland and £80 in England. Stephen Montgomery of the group says it's a shameful way to treat the industry, and we want fair support compared to other UK nations. So I was hoping for a response to that, please.
I've not seen the press release, so I'm not going to respond to something that I haven't seen. I'll respond once I've had the opportunity to see it. We will continue to do what we can to support hospitality and other sectors. On the first part of your question, I'll hand over to Gregor.
Simon, you've highlighted one of the important aspects of this vaccination programme with particularly it's not just the Pfizer vaccine, but all the vaccines that are currently in trials or have been approved for supply, is that the time to immunisation or the time to protective effect is not immediate. It takes its time to build up. And with the Pfizer vaccine, it's recommended that there are 2 doses separated by a period of at least 21 days in order that you build up that immunity to a kind of protective level. Now, that's not to say that there's no protection after the first dose. It starts to develop probably after about 12 days, but it's not full protection and people would still be vulnerable at that stage. That's why it's really important that people attend for both doses in order that they get the maximum effect, the maximum protection from the vaccine itself. In terms of then what happens next, it's probably about another further week or so after the second dose that people will get that maximum benefit from the vaccine. So it's not an immediate effect from that first injection. It's a full course, and it's probably about a week or so later after that second dose that people will have the protective effect.
Scott McNabb from this.
Sorry, can I just ask, once they've got that full protective effect, at that point, do you anticipate that they will be allowed to receive visitors, or do you think that the travel ban will remain for the time being?
You're asking me to speculate beyond where I'm prepared to speculate right now. The travel ban will have wider, if the travel restrictions remain in place, that will be because of wider issues as well. You know, it's going to be some time before significant proportion of the population are vaccinated with both doses. And of course, we still don't know, because it will be some time before the results of vaccination show this, the extent to which the vaccine stops transmission of the virus as opposed to suppressing the effects of the illness. So there's a lot we don't yet know, and you know, it's important that we share what we do know, but it is equally important that we don't start to speculate beyond what we don't know. I don't think that is helpful to anybody. Scott McNabb from the Scotsman.
Thank you, First Minister. On vaccination, again, it might be one for the Chief Medical Officer, but one of the groups earmarked for part of that first wave in the first half of next year are those with underlying health condition, under 50s with underlying health conditions. I'm wondering if you can give us some idea of examples of the kind of conditions they might be, to what extent they stretch. Could it include, for example, asthma? And who will make those decisions? Would it be GPs or the local health boards?
This will be driven by JCVI advice, but I'll hand over to the CMO.
So we know that there are certain categories of person with chronic conditions who are most likely to benefit from a vaccine such as has been produced. And JCVI are the body which make the specific recommendations as to both who should receive it and in what order we should prioritise them as well. So there are a number of chronic conditions that do include some chronic respiratory conditions, some other chronic conditions such as cardiovascular disease and diabetes, and we'll go into the full details of that once we are at the stage where we're ready to kind of go forward with that phase of the campaign. I think it's important that we concentrate on those who are most at risk and can be protected by making sure that they're vaccinated first. And when we have the supplies in place to be able to move to the next phase, we'll be able to make sure that we've started and embarked upon protecting those other people as well.
Christine Lavelle from The Sun.
Thank you, First Minister. This morning you've published the government's Guide to Etiquette and Pandemic Politeness, which includes suggestions for what people should say in awkward situations, like if someone's not wearing a mask. Clearly there'll be people who welcome this advice, but others are suggesting that it's over the top in treating people like children. What would you say in response to that? And are you able to say how much this guidance costs to produce?
How much it costs to produce, I don't know. I'm sure we can try and assess that. You know, we're trying to be as helpful as possible to people. People ask for guidance and all sorts of things. You know, people are not forced to follow it. This is a difficult situation. We're trying to help people through it as much as possible. But people are grown-ups. I've tried to treat people like grown-ups, and you know, people are perfectly able, if they feel it is better, to make their own decisions about how to handle some of these difficult situations that we all find ourselves in because of this pandemic. Tom Martin from the Daily Express.
Hi, thank you, First Minister. Good afternoon. There have been claims on social media this morning that have been picked up by at least one publication online that the Earl and Countess of Strathearn's visit to Edinburgh today is in breach of the cross-border travel restrictions. I just wondered, could you provide some clarity on the situation, and do you think the royal visit could help boost morale?
Look, the royal visit is a matter for the royal household and the arrangements around it, and I think any questions about those arrangements should be directed to the royal household. The Scottish Government was advised about the intention to visit, and we made sure that the royal household were aware, as you would expect, of all of the restrictions in place in Scotland, so that that could inform both the decision and the planning of the visit. But I think any questions about that should be directed to the royal household. Adele Merson from the P&G.
Thank you, First Minister. Last week you said if the situation merited it, both Aberdeen and Aberdeenshire could be moved into level 3 sooner than tomorrow's evaluation date. I was just curious as to whether the situation has remained confined to specific outbreaks, or do you anticipate a change to the level of restrictions in either of these areas tomorrow?
That will be something we are assessing over the course of today. Obviously, we didn't feel it was necessary to do it before now, and therefore the decision on that will fall to be taken as part of the wider suite of decisions that the Cabinet takes tomorrow morning, and I will set these out to Parliament tomorrow afternoon. Michael Blackley from the Daily Mail.
Thank you. Good afternoon. Could I check, please, if you have any further figures on the numbers in relation to the vaccination programme? Tomorrow, for example, how many vaccinators will actually get the vaccine tomorrow? And when do you expect to get through all of the vaccinators in order to then move on to care home residents? Will we see care home residents get the vaccine this week?
I don't have those precise figures to hand. We'll see what figures we can get and provide if possible later. As I said, I was at the Western General this morning, and the staff I was talking to there, they were vaccinators and they were about to be vaccinated tomorrow morning. They had, I think they said they had 60 people booked in just there tomorrow. So this will be something that progresses over the next number of days, and the situation with care homes was, as the Health Secretary set out in Parliament last week, in terms of getting supplies of the vaccine to start care home vaccination next week. But I'll ask the Health Secretary to say a bit more about that.
So in this first week, as the First Minister said, the vaccinators are the priority group, and we then move on to care homes next week. All of this, of course, contingent on supplies arriving as we expect them to. And in terms of care homes, this week we will use the time to ensure that the vaccine, everybody knows all the governance issues and handling issues around the vaccine, and the training was undertaken on Friday. We had 1,400 people join the training on Friday who will be involved in this, 2,300 booked for today's training, so that they get all the right governance and other handling procedures right and in place, and they have this week to do that with senior pharmacy colleagues overseeing that as well as with others, and in this week work through how we can safely, as I described before last week in the Parliament, pack down the packages that we get from Pfizer so that we have in the small enough quantities that allow us to transport that within the time period set for safety for the vaccine to care homes and manage then to vaccinate individual residents. And where we can, we're looking at how feasible this is, vaccinate both residents and staff in care homes. Now, all of that is being worked through this week, but we expect to begin the care home vaccination from next week.
And lastly, Tom Gordon from the Herald.
Hello there, First Minister. I suppose these are technical questions for the CMO and the Health Secretary, actually. Just to develop Michael's point, you must know at this point who is going to get the first wave of the vaccine. So can you tell us how many people are getting it ex officio? How many people are getting it because of their job, because they're vaccinators or care home staff or whatever? And also, the CMO mentioned that the full protection from the vaccine came 5 weeks after the first inoculation. Does that mean vaccinators have to wait 5 weeks before they administer the vaccine?
We will provide figures to the best of our ability in terms of the breakdown of who has been vaccinated. By ex officio, I'm taking, you mean people who are being vaccinated because of the job they do as opposed to their clinical vulnerability. The only groups that fall into that category are those doing the vaccination, and I think people would largely accept that that is a sensible precaution, and frontline health and care staff. Everybody else in those first groups will be people that the JCVI have deemed to be at greatest clinical risk, and of course part of the JCVI recommendation is health and care workers as well. I'll hand over.
First Minister.
That's where I will come back with the precise figures. I don't have the breakdown
What's the broad
in front
figure?
of me. Sorry?
What's the approximate figure
I'm not going to give you approximate figures. I'm going to come back to you with actual figures because I don't have the figures in front of me right now, and I think that's probably better to do than to come back or to answer you now with information that I don't have accurately in front of me. In terms of the wider questions about vaccinators and numbers of vaccinators, I'll ask the Health Secretary to say a word, and then I think there was a part of your question for the CMO as well.
So we said in one of the statements, the first statement I think I made to Parliament, that we estimated that we needed a total of 2,000 whole-time equivalent by the end of January as a mix of NHS healthcare staff who would be vaccinating and overseeing the process clinically, and support staff. And for this week, our estimate for the numbers that we will be doing in this first week, we need around about 160 to 165 whole-time equivalent vaccinators this week. So we'll work our way through that as those individuals are themselves vaccinated.
And Gregor, that was a part of the question.
So, Tom, as I've already said, it's a gradually increasing protection that occurs with these 2 doses of the vaccine. Probably starts about 10 to 12 days after the first dose. It rises and then is augmented by the second dose and probably reaches its full effect by about a week after or so after that. The 2 doses need to be given a minimum of 21 days apart. But in terms of what I think was I understood by your question, I think one of the things I would point out and that we have to be very clear about is that having had the vaccine is not a replacement for wearing the correct personal protective equipment for whether you're a vaccinator for COVID-19, for flu, or for any of the childhood vaccinations that you do as well. There will still be a requirement for that PPE to be worn, both to protect yourself, but also, of course, to protect others, because as yet we don't yet know the impact on transmission fully for this vaccine. So if the suggestion was that the vaccine would be a replacement for that PPE, I have to say to you that that's not the case. PPE is still something that we would expect all our staff to continue to wear in situations where they may be exposed to the virus, and that will go on for some time yet.
That wasn't actually the suggestion, CMO. I was just wondering whether there would be a gap between people receiving the vaccine in their first dose and then being able to go into the field and administer it.
No. So the staff I spoke at this morning will get their first dose of the vaccine tomorrow, and they will be part of the vaccination programme from them. So there will not be a gap. It is a sensible precaution to vaccinate the vaccinators early in the programme, but as the CMO says, these people will have other precautions in terms of PPE. Okay, that concludes the questions. Thank you to all the journalists for joining us. Thanks to Jill for our BSL interpretation, and to Jeane and Gregor, and thanks to all of you for joining us. Tomorrow is a big day. It's an important day, a day that has been a long time in coming, when we take the first steps on the vaccination in the vaccination programme and take the first steps towards that light at the end of the tunnel. But in the meantime, please continue to stick to all of the rules and protections, because they remain important as we go through the winter period to protect ourselves and each other. And I will see you tomorrow from Parliament at, I think, 2:20, when I'll set out the outcome of our decisions on the levels of protection. Until then, thanks for joining us.